Joe Minarik, can we do this? Can we reach fiscal sustainability and protect the middle class from any pain?
No. It is going to be essential, and the Bipartisan Policy Center's plan essentially takes the 20%, the low end of the income scale with all of our changes in taxes and all of our identifiable changes in spending and holds them harmless. Above that bottom 20%, you have small gradual increases in tax burdens. Unfortunately, we've got a very big problem, and there is, I think Stuart is exactly right, the most vulnerable in our society should be protected, but there is going to be a need to increase revenues, there is going to be a need to cut programs, and those effects will be felt. There are some improvements in efficiency as well, but at the bottom end, the bottom line, we're talking about trillions of dollars of budget savings that are necessary.
I think one of the great contributions that the Peterson Foundation made in doing the exercise this way is that we have the advantage that you all had to put down plans that were comprehensive, and you had to go through the pain of having them scored by some people who know how to score these things so they're on the same yardstick. And it is interesting, Susan Tanaka, the foundation, made a little chart for me that 3 of the plans, AEI, Bipartisan Policy Center, and Heritage, actually leave us with smaller deficits over the next decade than either the Ryan budget or the Simpson-Bowles budget. The others don't, but I think that it does, what this shows us is different visions, and obviously the final compromise, if there ever is one, isn't going to look like any of these. But I think that they raise an interesting question, and I want to ask first Stuart and Alan. You would cut taxes, and then you would cut spending a lot in order to get to fiscal sustainability. But what if you can't get those spending cuts? Which would you prefer, fiscal sustainability or giving ground on your tax objective?
Okay, well, in our plan, we have revenue settle down to 19.9% of GDP, which is well below where you would be if you allow currently enacted law to stay in place, have the AMT spread, and the Bush tax cuts expire for everyone.
But a little higher than the historical average.
But we are a little bit above the historical average. I think that the choice that you pose is not really a choice at all in some sense, that if you don't have a fiscally sustainable regime, then of course you have to service that debt eventually. I mean, if it's literally true that you cannot get the spending cuts, then obviously revenue is the only alternative. But we really believe that it's important to emphasize the spending cuts and to keep marginal rates low to promote economic growth.
How would you describe it?
If you say that if we can't get the spending cuts, would we rather have tax increases? That gets us completely on the spiral that we've been on for so long. It moves us up.
No, I think it's a matter of degree. If we can't get all, you have a very small, as a share of GDP, government spending relative to the other plans.
That is correct.
If you can't get those spending cuts, would you rather have bigger deficits, or
no? I'd rather aim for the spending cuts, because the fact is the spending cuts are essential, because if you don't achieve those, you are not going to get onto sustainability. The size of the federal government as a whole is the deadweight loss on the economy as a whole. So this idea that you can sort of give up in some way on the spending side, particularly on the entitlement area, and then somehow make it up on the tax side, I think is a fool's errand. You just will not get sustainability over time.
All right, let me ask the others of you who have a different approach, which is you in order to protect spending, or in some cases increase it, you would raise taxes. If that becomes impossible, would you rather have bigger deficits, or would you rather have settle for deeper spending cuts? Do you want to start, Zach?
Sure. The biggest portion, if you saw our graph up there, of our savings comes from our healthcare reform. So if I think it's a false choice, spending cuts, tax increases, it is a spending cut, but it's not a benefit cut. It's really about making the healthcare system work better. And I think that people aren't being honest when they say that there's nothing we can do. Medical inflation is not destiny, and that's been proven. But I would say we would scale back our spending commitments if we couldn't do tax increases.
Okay, John, you have a lot of spending relative to the other panelists. If you can't get the tax increases, how do you get to?
I think there's a couple of points, right? First is, I think this notion of more spending versus less spending. Yes, spending as a share of GDP is higher under our plan than under, I think, anyone else on this stage. But there's also, we don't increase everything, right? We do reallocate dollars. We have significantly lower levels of defense spending than I think most of the people on this stage too. So there are reallocations. So it's not about spending more, spending less. It's about where you want to spend the scarce dollars that we have. The second point, to answer your question more directly, in the short run, I would much rather have higher deficits, right? So I would not want to adjust my spending levels in the short run. We need jobs, we need economic growth. If we have austerity too soon by cutting back on spending at the levels that Heritage has suggested or others, that means a double-dip recession, straight out. So I think in the short run, absolutely, it is imperative that we maintain or even increase the overall levels of spending to get the economy back onto a sustainable trajectory. Over the long run, I think that's a very interesting question, because over the long run, we do need to look at revenues, we do need to look at the overall budget, and we know that we're on a very unsustainable path, right? It can't go on like this forever. And so at the end of the day, you're going to have to adjust something. Logically speaking, if taxes are somehow completely off the table, then yes, you have to cut spending. And if taxes are off the table, that means spending cuts on Medicare, Medicaid, on the order that perhaps Heritage suggested, or at least Paul Ryan. And so that's a question. Do you want to have spending that cuts by 40 or 50% all of our spending on Medicare, or do you want to have some revenue increases? So I think you're absolutely right. I would argue that you should have the revenue increases. Others obviously argue the reverse.
Now, you mentioned, I think quite correctly, the healthcare thing, and I thought there was a very interesting divide in the plans. In a very gross simplification, some of the plans would use the power of the government and the Independent Payment Advisory Board and bundling of the healthcare to make a more efficient system that way, and the others would move towards a system where people are more responsible for their costs, and the competition, their shopping and the competition among providers would bring down costs. Joe, I want to ask you a question about something. So there's been a lot of noise lately about premium support, which Paul Ryan has come close to making a dirty word. But your plan, and I know Alice Rivlin, who worked on your plan, is quite vociferous about this, sees that as the best way to get healthcare costs down. Can you explain why it's a good idea, and why is your premium support thing somehow different than the one that Paul Ryan is talking about that's getting so much credit?
Okay, why is it the way to go? The best way to have control of costs in the healthcare system is to create incentives such that people want to do that. There are basically two ways to approach that. One way is to give people dollars and tell them, you're sick, you have a very serious heart ailment, or you've just been diagnosed with cancer. Go out and take those dollars, pick your physician, tell him how to treat you, tell him what hospital to take you to. Now, obviously, that's absurd. People hire doctors because they need advice from professionals. The other way to do it is to give people dollars when they're well, as we do in the Federal Employees Health Benefits Plan, and tell them, go out and look among a choice of private healthcare plans and see which of those would do the best job of treating you in the way you want for a price that you believe is such that you get value. That's what we would try to do. In the Medicare system, we would have one additional option, and you mentioned differences between the BPC proposal and the Ryan plan. There are basically two. One difference is, and we're talking about Medicare here, one difference is that the BPC proposal would allow individuals to stay in traditional Medicare if they wanted to, whereas the Ryan plan would eliminate that. The second thing is that the Ryan plan would tie a very tight noose around the growth of healthcare costs, essentially at the rate of inflation. And what we would do is we would take at the margin 0.7 percentage points of annual growth out of the system as an inducement to providers to
So in other words,
be more efficient.
the individual would get more money under your plan than Ryan's, even though the structure would be similar, and he or she would have a choice of traditional Medicare. Michael, your plan, if I remember right, doesn't go the premium support route. Why do you think that's not the way to go?
Well, our concern with a plan like, with premium support is that it really, especially when it's coupled with taking away the exclusion for employer-provided health insurance, is you're really, very quickly in most of these plans that do this, cutting out the underpinnings of how we've been paying for health care for decades.
I thought that was the idea.
Yeah, well, but fair enough. But, you know, I think, and it's all kind of based on this hope, this prayer that markets, which have thus far performed very poorly in keeping healthcare costs down, will now start keeping healthcare costs down. And so all of a sudden you're having all these people out in the market, you know, hoping and praying that the price will be down. And if that doesn't work, the downside risk of that is a huge burden on people, both in terms of the quality of the care they get and in terms of co-payments and out-of-pocket expenses. And so we think it's very risky. And we also think that there is a little time here before the real big costs of healthcare start kicking in. And so, you know, we prefer an approach that's really, you know, working more within the current system, actually, trying to reform it, make it operate more efficiently and better to try to get savings.
But isn't that alternative just as unproven as the market one? I mean, we've been trying this with DRGs ever since I was in college. There was one or another thing that was going to be the magic bullet that brought healthcare. Is there any?
Well, I think that's a fair point about it being unproven, but I do think we have some time to you know, I mean, it's been greatly enhanced. This is all, with the Affordable Care Act and the kinds of additional things we're proposing. You put in place a system where we're really working it, and you'll have 10, 15 years to see, and we'll know within a few years whether it's working or not.
Stuart, you look like you need to say something.
No, I think this is a fundamental divide because it's a divide over power and control. I mean, it's right. They're correct that the CAP plan, the EPI, and so on, they want to aggressively use the Obamacare boards and so forth, which has a board that will systematically reduce payments to doctors and hospitals. They want to do that aggressively, and they want to expand it to the private sector. That puts the power and the control in an unelected board to ratchet down healthcare. It may well work because it can work by basically dramatically reducing what people can get. The other way of looking at power and control is as Joe said, to move it to individuals, to let people have control over whether they want to fire their health insurer and so on. And that's the divide, whether you see power in the health system going to families and individuals, or whether you see power going to boards. And that's the basic fundamental divide here.
Joe? And then
There are models of market-based systems that have worked very well. The federal employee system is one, although it could be improved significantly. Ironically, one of the best models out there is the Wisconsin state employee system, which has held costs down for Wisconsin employees and also caused the creation of some very efficient integrated delivery systems in Wisconsin.
John, you look like you need to say something too.
Yeah, absolutely. I think the description of where the power lies is very inaccurate. The power right now lies with health insurance executives. And that's where it would lie if you had a reform that turned it into vouchers, even more so. Listen, you know, my father's a doctor. He runs a small allergy clinic up in Bethesda. If anyone's been sneezing over this season, let me know. I'll give you a very good recommendation. He spends a lot of his time, a lot of his staff's time dealing with health insurance companies and trying to walk through myriad hoops and hurdles and forms to try to get the simplest allergy shot, a $10 shot in your arm, costs them so much more in terms of pain and just the resources wasted on dealing with insurance companies as it is. I think we do have a proof. You mentioned proof before. We have a proof that the current system doesn't work. And that if we go towards a system where we have Medicare, kind of where everyone is thrown into the current system, which we know doesn't work. Competition does not work to provide adequate care at a reasonable cost. The United States spends more on health care than any other country in the world and does not get what we pay for. Right? So the idea that we double down on the current system, I think fundamentally doesn't work as a solution to health care. So I think that's why we take a fundamentally different approach, and I'm not going to speak for Cap, but he's nodding his head, so I will.
Alan, do you want to weigh in on healthcare? You don't
Well,
have
yeah, I guess my philosophy is more similar to Stuart's on this, but I do want to make another point, which is that the other argument for premium support is that it's one mechanism for implementing the principle that Stuart mentioned earlier in terms of limiting the role of government. That with premium support, you're saying that we'll provide a limited subsidy, it'll be a budgeted item in a sense where the cost can be controlled, and that we are in effect scaling back the federal government's role in providing health care to those people who can afford to provide it for themselves. In a sense, it's a movement towards individual responsibility by saying that the government cannot provide a blank check for medical care for everyone who happens to be 65 or older, even though it is absolutely imperative that it maintain a safety net for those people who are in need.